Welcome to episode 7 of Prompt Me podcast, where we interview creatives and ask them to leave a prompt for your own creation. I'm Kendra Fair with John Hancock, and today our guest is Dr. Kelli Jo Hyland. She's a physician specialized in adult psychiatry. Currently, she works with veterans at the VA. Most importantly, she is one of our dearest, most favorite friends of more than 2 decades. Without further ado, today we have Dr. Kelli Jo Hyland.
Kelly's fine.
A doctor, it makes us feel more important. We sound more important because we managed to get an actual doctor in here.
Well, and the other thing that I think is really cool about it is that Kelli is a doctor and she is also an artist of many, many different disciplines. So for a starter, she is the one who designed our Prompt Me logo.
Right.
And I just asked her for her handwriting because it's so fabulous. And she designed the whole thing, and it was better than anything that we had come up with. So
yeah, we had a few logos that looked like perfect logos if we were a 90s acoustic band.
Yep.
Right? Like they were really good. Like, but it would have been the perfect, like, if you like Hootie and the Blowfish, just wait till, you know what I mean? Toad the Wet Sprocket? Well, how about a podcast? It's totally that.
That actually sounds really fun. Let's make that our next collaborative project.
Exactly. A podcast about nothing but 90s acoustic bands.
Oh, you're very sweet, Kendra. But I wrote a couple words and wrote some circles around it.
And put an airplane and did some cool circles and yeah.
Well, I love your airplane theme. I think I had the great good fortune of not being an artist or a graphic designer. And so there was like no pressure, but I do know you well enough that I could think about, you've been talking about this project for a long time. And I feel like I really have the inside scoop on what it means to you and how I feel about you doing it, which I feel like incredibly enthusiastically supportive because I think it's such a great idea. And I think you get to share something about you that I love so much with the world, which makes me like, see? Like, see what I see? This is like so cool. And so like that airplane, I know has so much meaning. And that was a project when you painted that series of the airplane that I remember as well as I could your emotional experience during that time. And you created such an amazing body of work that showed me, as much as I knew you before that, it showed me more of you as a person and as an artist. So that airplane has a lot of meaning in my own experience. I know it has a totally different, really meaningful aspect in yours too. But anyway, the logo.
Yes. So that's one of the many things we can thank you for is the logo. But
well, I love being a part of your project in a more like, what's the word?
Direct.
Yeah, way. Like, yeah, it's kind of sweet.
And I'm also really excited to have you talking about art because
I was trying to avoid that part.
Yeah.
I
know
if
I ask you the doctor questions, then I'm sure you'll have those. But I do want to mention that Kelli is a poet. She has won poetry contest, had her poetry published. She's also a visual artist. She also went through a baking phase where she was a cupcake artist. Do you remember that, John?
Yeah, I do.
And we got the fine fortune of receiving all her cupcakes. I know you, and I know that you have art that surrounds your life and that you create art every single day. And I think that's something that would be really interesting for other people to hear about, that somebody that's a doctor that's very scientific, and we see doctors in this little mold of who they are, and then to know that a lot of doctors have a secret artistic side.
Well, I'm going to tell you another little secret. doctors are also human beings.
What?
Weird, huh?
I know. So
No, but-
disappointed when I heard that.
Well, I think for a long time in the traditional sense, like we have this idea of like what a doctor is, like not to avoid again the real conversation, but maybe to avoid the real conversation. I get people all the time like, you don't look like a doctor. I'm like, well, I am a doctor, and this is what I look like. What kind of goes through my head, but I think.
I was going to say you just need to be wearing the white coat
Yeah.
and a stethoscope all the time.
People
And-
have an idea. And I think that's one of the wonderful things about more women entering the field and more, it's not just for white men anymore being a doctor. You know, you have people from different cultural backgrounds, and there's lots of different ways to heal people, like even within Western medicine. And it's nice that we all get to see more of that, hopefully for our patients and certainly for us. Anyway, sorry.
Yeah, that's good.
Off topic.
So no, it's not really though, because I think that when you're finding different ways to heal people, that is an art in and of itself. That you're being very creative when you're figuring out those different ways to heal people. And I also know you well enough, and I don't know what you do with your patients, but I would guess that you are encouraging some way of them being creative too in their healing process. Would that be accurate?
Always. Yes, absolutely. That's a really great guess. I mean, I should mention here that I'm a physician. I'm a medical doctor, but I'm a psychiatrist. So I get to know people through their stories. And not all doctors have the opportunity to spend time with their patients and get to know them like I do. They have to meet with them for 15 minutes and they're on to the next thing. It's a more technical kind of work. And so I get to spend time with my patients. I work in a setting, the Veterans Hospital, where because we don't, we're funded, like it's basically like socialized medicine, you know. I have a little more time with my patients and even my psychiatrist colleagues in the private sector who have to see more patients in a day. I get to do, I think, in a lot of ways, better care, better patient-centered care instead of administrator or, whoever the payer is demanding. So I love that about my job, is that I do get to spend more time with my patients. I get to know them. And I've always loved story. I mean, I think my first passion was reading. I was very young when I learned how to read. I spent a lot of time reading. I love story. I love books. I love words. And I think I'm really lucky because I get to hear story all day long, every day. But it's also not just the relationship, but the story is how I get to know patients and help patients. As a physician, I think we're all creative problem solvers. We have to be. Because they're very complex problems that we solve or think through. I think, I have the opportunity that I get to bring my ability to understand narrative and think outside the box and understand people that I wouldn't necessarily normally get to know or get the opportunity to understand. Like I get to ask questions. I get to hear the most amazing stories. And I get to help them in ways that maybe they haven't thought of that they expose me to. And a lot of their cure lies in not just creative answers, but creativity. And so I can prescribe, in quotes, I'm doing air quotes right now, that they find their art or they reconnect to their art. And a lot of times that's what heals them more than any medication that I would prescribe. So I feel really lucky.
They want to, when they come to you, they want to tell you their stories, right?
Yeah, even if they don't want to. They want to.
They want to.
Right?
That's what I mean. Yeah. They know why they're there.
Yeah.
Maybe?
Sometimes it depends because people get confused. Like, it's not always clear my role. So people think I'm a psychologist, I'm going to do therapy, or they think, so they're not always sure. I mean, I think we have an idea of what a doctor is, but we have even more like strange ideas about what a psychiatrist does. Like, some people still think I'm going to like zap them.
Right.
They think of one
With a
flew over
taser.
flew over the cuckoo's nest.
Right.
I got a lot of Vietnam era guys
Yeah.
that are just now coming for treatment because they're retired and they're losing their partner or whatever. They're in a place in their life where they're starting to be uncomfortable enough that they seek help. And so there's some really archaic ideas, I think, about what a psychiatrist is. I've even had younger colleagues, like when I went into private practice, I had these younger colleagues in the community that are therapists that were like, we always thought of a psychiatrist as someone with like a pipe and a jacket with like leather pads on the shoulders, not shoulders.
On the elbows.
On the
elbows. Thank you.
On the shoulders.
It's just like
Sure.
anatomy. I mean, it was so long ago.
Hunting
Yeah.
coats, yeah. Anatomy.
So, med school is a long time ago. So, and I think in some ways, now that I'm talking about that again and sort of our expectations when you come into the room or you come across me in a clinical setting, is that in some ways it's a gift to be able to surprise people. Like, I think catching them off guard, or, when I don't have horns, when I'm not going to try and push meds on them, when I do understand the medical pieces, but I am interested in their story. I think it's very often gives me a doorway that I wouldn't normally have had.
Right.
And so maybe they didn't want to tell me their story, or there's a lot of trauma in their story. But I think we all want to feel seen, and when we share our story or share what's important to us about our story or about ourselves.
And I would think that when they share that and you reflect that back to them, that maybe they see their story in a different way.
Yeah. I mean, that's the goal. I mean, that's therapy. I'm not the best
Yeah.
therapist, but hopefully I am therapeutic, and I think that's the goal, is that they can have had the same experience that they already had and maybe view it from a different place. Yeah. See themselves a little bit differently, but I do get to be really frank with them and to tell them how I experience them. I mean, that's another experience we don't always get, right? Is for people to be, authentic back to us, a place where we can be authentic and not feel judged or not try and be fixed, which is really ironic because they're coming to me a lot of times to be fixed, and I'm not really there to fix them. Don't tell my bosses that. Again, nobody's paying for me, I guess. No, you're paying for me. Your taxes are paying for you.
Yes,
so please don't tell anyone.
Exactly.
So no one's going to listen, right?
Out. This can't go out at all, right?
I'm not really. Yeah, I guess I get to surprise them with what they're actually there for. So I totally lost track of what I was saying.
Well, so to bring the art piece back into it, how do you feel that your art, all the many different disciplines that you do art in, how do you feel that plays into maybe what you do with patients? Or is it just like a balance that's very opposite of what work is, and so that keeps you balanced as a person?
That's a great
Or
question. Oh my gosh, Kendra, that's a good question. I have to think about that. I think part of what's hard about that question, and even sitting here in this chair, is I'm not really comfortable yet entirely identifying as an artist, which is partially why I'm here, right? Because, one of the things I love about you is that that everybody is capable of creativity and art of sorts. Like, just like the definition of a doctor or psychiatrist might be too narrow in a lot of people's view. Like, I think, you can correct me if I'm wrong, but I think of you as having this really broad, open, expansive definition of an artist or creative person. I know creative as a noun now, but as a creative.
Yeah.
And I love that idea intellectually. I love that concept. But at the same time, I believe in that strongly. But at the same time, I struggle with my own identity as an artist, even intellectually knowing that and believing you. So I think I'll start with the latter part of that question, which was about balancing. So I would say yes. When I write, when I try and create visually, I do go to this place, or to make the art happen, I have to be in this place that brings me to a more mindful space. Does that make sense, what I'm saying? And sometimes my work is very much in my head, and art and creating art and writing brings me into my body. And meditation, which is what I do as a habit, also brings me into my body in a way that helps me create. So they kind of feed each other. And so it gives me a balance to the intellectual work or the caregiving. I think a lot of it for me is the balance is the caregiving. Because art to me feels, when I do art, the kind of art I'm trying to do now, it feels like self-care. It feels like caregiving for myself.
That makes sense.
And it also feels like prayer, which is kind of what I was getting at when that mindfulness piece, that sacred piece, that presence piece. But so much of my life, and this is reinforced by medicine and the kind of work I do and the kind of work I want to do, so much of my life is caregiving, and I'm a mother too. Of course, you know that. And so especially now that my daughter's in her teenage years, my career's in its teenage years, and there's less excuses for me to focus outwardly and take care of people that are not me. I'm practicing receiving, which is that being open to the spiritual aspects. And there's that practice of internal exploration and self-inquiry, but not like, again, not like I'm going to fix something, not like I'm trying to achieve some personal growth level, but how I try and approach my patients. That's what I'm trying to practice, learning how to approach myself with just like this really compassionate, non-judgmental curiosity.
Yeah, kind of a journey. So you're like going on a journey without a destination.
Yeah. Yes. So no ideas, no judgments, no like right or wrong. And when I'm in a room with a patient, that's how I try and approach them, is total curiosity. No ideas, just questions, just love. But I'm not the best at giving myself that same sort of acceptance and curiosity. So for me, I'm very early in my artist journey in that I'm just trying to find a place of quietness enough that I can turn off my brain enough, my judgment, my anxiety, my planning, doctory, what got me through medical school, which I love those parts of myself, but like just trying to quiet that enough that I can even hear what I have going on internally, like who's Kelli, who's the person that's not Dr. Hyland, like originally, not like before I but before I began to people please or caregive or be a thing. So, so I think that's what art is for me right now in a lot of ways. And the first part of your question was about how does the art that I do, how do I bring that to the work that I do? I think probably in that same roundabout way where if I'm more compassionate towards myself, less judgmental, more present, less judging, less fixing of myself, I think it makes me more available in the room. I think there are less opportunities for me to get reactive or triggered or to bring my own shit into the room.
It's okay. We'll just beep. No. Okay.
Sorry. I'm very sweary. That's another thing I like about being at the VA is like the vets don't mind. I get to be sweary. They actually really like it. It's another unexpected thing. Like, oh, okay.
Yeah.
We're going to get along here, Dr. Hyland, with your F words. And yeah, it just helps. It helps me. It calms me. It helps me, I think, be more in the room, if that makes sense.
Yeah.
So I don't think it's really direct because I think I've probably always been a creative problem solver and a empathic person.
Yeah.
You know, a lot of the things that art does for us, I think, you know, those have been part of who I am and what I bring without, which are probably things that help make a person a good artist. But
Well, something you said there that is standing out to me because now I'm going back through all the many years that I've known you, and this curiosity piece. It's like that's what sparks you to do art. When I think back about it, it's like you got curious about baking cupcakes, and so then you went and did that, and then I know you've done some of the drawing things like Inktober. So there's a curiosity in that, or the nano one. What is that one? The
NaNoWriMo?
Yeah,
and NaNoWriMo. I've done both of them.
And you've done both of them. So you've literally written a whole novel that I have yet to read. Someday, we're hoping. But so I know those things, you get this little curiosity, and then you carry that. And I'm thinking back to when you did do your end of medical school project, that story project. It was having people be curious about something, and you met with them, and then you would have these other doctors become curious about it, art, and do this. So this curiosity piece, like all of a sudden when you said that, I kind of did this backwards reel and noticed all these things that are like a spark for you, like a curiosity, and then also sometimes the piece of taking on a specific thing for a specific amount of time. A lot of these are the month
I love
things.
the structure. Yeah.
I love there's
that.
a structure. So there's like a curiosity mixed with a structure that really sparks your creativity. That's what I'm...
I love that you've known me long enough to have that, okay, out there in Radio Land, you guys have to know that Kendra is my brain. So, I know the names of medications and how to use them. Don't worry about that. So I can remember some things, but you remember all these historical things that I don't.
I remember weird little...
Anyways, I love that about you.
Yeah, it's great when you're married too.
I bet.
Having someone remember everything
you're being
you've
facetious.
ever said.
I married someone like that too. Hi, Mike. Yeah. Once I've left the room, it's gone. Which has its own fine qualities about it and hard things too. Yeah, I love that you've known me long enough to see that pattern and notice that and reflect that back to me. Because thanks. I love that. That's cool. I'll take that. And it's true. Like, I think one of the things with these creative, artistic things that you've mentioned, I'll come back to the storytelling project for school, which I also love that you brought up because I don't think of that as been one of the creative things I've done, but you're right, it is. But a lot of the things you've mentioned and that I've done, I think it helps that I don't have to be good at it. I get to have beginner mind, right? Which is
Yeah, that
sort
gives
of-
you freedom.
ideal, right?
Yeah.
But and I think that's the beauty of the groundedness about having accomplished the physician thing. It's just because it's just part of it helps me, like, in terms of my identity, which it's, it's attached to ego. So, whatever, it's a little bit of a cheat. It's like, well, I'm a doctor, so like I've got that and that's something. So I can totally look like a fool,
works.
doing all this other stuff that that just looks fun and interesting, and I don't have to be good at it. I don't have to know how to do it. So it's nice to get to be
Beginner's mind.
stupid. Yeah.
Yeah.
Oh, that's where I was going with it. Was that in one area I feel like an expert. So it's easy for me to offer myself the freedom to goof off. And so I guess that's another blessing of art. Well, it's, again, like you said, balances the heaviness of my work and my career and my life in a lot of ways since I was little. So I feel really lucky that I have the privileges that I do, that I have the economic and academic, and I have a job during a pandemic, and I have so many privileges that allow me the privilege of rest and goofing off of art, right?
Yeah.
So, there's a lot of, I grew up admiring art, loving art. Like I said, I loved reading literature passionately, but
You
my
still
mom
do.
was,
You
yes.
still read like a book a day while you create art and are a doctor. Anyway, there's that too.
Well, it's a little bit cheating too because, I was thinking about it before I came over here. I mean, some of the confidence about doing different art and different mediums is understanding the tools and the language and having a confidence, that you can speak the language, and there's a certain amount that you have to learn the language and the tools before you can even get started in art. And the fact that I could read well and read fast and that I did so much of it, that paid off when I went to medical school because there's a lot of reading and there's a lot of tests, and that wasn't that hard for me. But a lot of the things that art requires are really hard for me, and it is hard for me sometimes to not be as good at something. I think probably a lot of artists struggle with this that are actually real artists, where you do admire and look up to and know how good you want it to be, but you struggle with that liminal space where you're just not there yet. Like, you want it to be that good and you know what good means. And it just takes your 10,000 or 40,000 hours, and that's where you have to I mean, of course, I'm talking about how easy it is for me to goof off and have beginner mind, but like, especially with visual art, I get hung up about getting started and wasting paper and wasting paints and wasting crowns. And, I've probably spent thousands of dollars on my daughter's markers and paints and crowns and paper, but I freak out doing that on my own. But, so what was the question?
Exactly.
Curiosity.
And having that
Structure.
And then, so let's take it back to the story conference that you did with the medical students.
Oh, I love that project. I love the opportunity to talk about that project because
It was a very cool
wasn't.
project.
Thank you. And I'm so glad that you guys got to witness that because, I married really well. This is connected. In my very circular, nonlinear way of storytelling.
Yes.
So I married an artist, and because of that, I got to be with all these artists. So like I was kind of starting to say before, is that I love art. My mom's an artist. My brother's an artist. My daughter's an artist. My grandfather was an artist. My grandmother, my dad's mom, doodled and painted, and I love artists, and I married an artist, and because of that, I get to spend my life with artists. You two in particular. But a lot of really cool people come through my house because my husband's studio is in my backyard.
It's yours too.
And so anyways, I got to do this project, and I love that I had artists witnessing this really academic experience for me. And part of what's beautiful about that, and part of what's hard for me to talk about that project, is that academically it wasn't 100% understood or even well received by people that I wanted to please in my training program.
And yet you've figured out as years have gone by that wasn't the important part about it.
No.
The important part was the doing of it.
Yeah. So the project that Kendra's talking about is when you are in a psychiatry residency, it's 4 years. And that's after you've already done 4 years of medical school. And the first 2 years in our training program here in Utah was all inpatient medicine and psychiatry. So I spent half of my first year doing just internal medicine in the hospital and neurology in the hospital. And then those were the long call hours and 80, 90, 100-hour weeks.
We remember when she did that. We remember.
When I would nurse Scout in 10 o'clock at night in the Starbucks.
Mike would run her up for you.
Yeah. So those first 2 years were all in the hospital, either doing medicine or doing psychiatry in the hospital. And the second 2 years, we transitioned from a certain kind of psychiatry, which is really different inpatient than outpatient, where you or I might go see a psychiatrist. And don't need to be in a hospital probably ever. And so the last half of my training program was in outpatient psychiatry, outpatient clinics. And so it turned out to be a very different kind of medicine. And part of my brain really loved the sort of complex problem solving and algorithmic, like intense cases of the hospital. It's you feel like a doctor. Like it's fast paced, it's intense. Like you have to be, on your game. And there's something I really loved about that. And then when we went outpatient, and you did have to sit in the room, and you did get to hear stories, my anxiety really came up because I had all these ideas about how to fix people. They're coming to me, they want to be fixed. And I've got all the answers. I've spent all this time learning all the answers. I've got it. Like it's like med school, reading all those books and taking the test. I'm going to get an A on this, right? People come in and say, I've got these symptoms, and I tell them how to fix it. And it turned out really fast in my third year of residency that did not work. So all that stuff I was saying earlier about being with people and knowing their story, I could not do that part. I couldn't do it. And yet I always pictured myself as an outpatient psychiatrist. And at this time in this program, people kind of either ended up in one career path or another. Not a lot of people did both. And so my idea was that I do outpatient psychiatry. And here I was in outpatient clinic. And I'm like, wait, you said you wanted to be fixed. You wanted to feel better. And I just told you how to do it. I'm not saying this to the patient, but P.S. I'm just realizing my frustration after several sessions. And I've told them what to do. And they have done it or not done it, but they still come with the same complaints. And so that made me very anxious. And it took me a while to understand that even though they were saying they want to feel better, or they want this or that symptom to go away, or they want to be fixed, that really they wanted to feel heard, seen, understood, all these other things that after coming out of this fast-paced, I'm a doctor, I'm going to fix you, problem-solving intensity, where lives are saved, by the way. Lives are saved.
Exactly.
Literally, they are.
Yeah.
and it feels really important
Yeah.
that I'm going to have to find a way to calm my shit down so I can sit with people and give them what they really want or need or what's actually going to help them, and not just, spew out some computer program from my burnt noggin.
Yeah.
Right.
And so when I got to my 4th year, we had to do a senior project, my 4th year of residency. And what a lot of people did was like a literature review, where they were supposed to spend the whole year doing a project or research. And a lot of research is how people think about research, where you test a program or a therapy or a med. Now, our senior project we didn't get enough time to do like trial a med or do some really fancy research project. So it was a little loose. They wanted you to spend the year. You had an hour a week or a half a day a week or something of time allotted to dedicate to spending a year doing a project and presenting it at the end of your senior year. And what I'd seen people do as I'd gone to these project presentations was some people would just do a quote unquote, I'm doing air quotes again, by the way,
Right.
literature review, which is basically just reading a bunch of stuff on a topic and then doing a PowerPoint, which is not unhelpful, right?
Yeah.
And it's not work.
Yeah.
Right.
But I didn't want to do that. So I was thinking back to when I was newly a 3rd year, and here I was a 4th year, and I was still doing a lot of clinics at the VA. And so they made me like the VA senior resident. And they gave me an hour a week to spend with these 3rd year residents. So these were residents that were coming out of their 2nd year of intense work and training in a very specific way. And they're entering into that 3rd year. And I got an hour a week with them. And so I was thinking about what would have been helpful to me, and how could I help them in a way that would make me happy. And so that's where the curiosity came in. So I had this idea of like a weekly sort of salon, air quotes again, where we could talk about a topic, or they could just come to me with something, or I really had this, you're right, I had this creativity idea in mind where it would expand beyond how we had thought about psychiatry, how we thought about patients, and expand it into these more creative, bringing more of ourselves to the table, to the office, to the patient, and have it be more relational and be comfortable sitting with uncomfortable feelings and these, relationships that we're going to have to create to help people. And so I wanted to bring creative people into a setting, and medical people, and doctors of psychology and different disciplines. I had this idea of bringing all these different disciplines in and having these conversations, these sort of artistic salon style. So I started doing a lot of literature review on if anybody done anything like this. And of course, we all read in the New York Times now that they're training med students how to look at art and how it helps.
Yes.
The humanities, medical humanities, and it's really cool that they're bringing these arts to medical students. But there was not anything like what I sort of fantasized or imagined that would help this sort of really specific thing that I'd gone through that I wanted to help other people through. And so the salon idea eventually, to make a long story short, I just went with curiosity. I had 3 residents, usually a month. I had them for a month. And so I went to them and just asked them who they were. So I sat with each resident one-on-one at the beginning of the month, and I asked them, why medicine? Why psychiatry? What in psychiatry do you love and are drawn to? And what outside of medicine and psychiatry do you love? Just 4 questions. Yeah. So curiosity. So I just went to them. And together we sort of created this project. So I got to hear their stories, and then I used each of those stories to spend a week, each week of the rest of the month. We go to lunch. one day each week, and I would have brought somebody in to go to lunch with us that matched that one person. So each person had their own week. And I used their story to help me connect with them with somebody that was further along the path, whether it was in medicine specifically or psychiatry specifically or in a completely different field, but somebody that I wanted to introduce to this small group of people, me and these other 3 residents, in a setting that one resident at that lunch would get to see somebody doing something that they were interested in and how they combined it with their career or their life. And so we had these really fascinating conversations and lunches. And then the last week of the month, I would have asked them over the month to spend some time in any creative way they wanted. It could be a presentation, it could be a piece of art, it could be a piece of writing, it could be anything they wanted that they could bring just to me and the other residents at the end, something of themselves, like something that they'd shared with me personally one-on-one. I wanted them to share with all of us that they'd sort of been processing or creating over the month. And the intention was to show them more of who they could be that isn't in a hospital saving people's lives by giving them the right medicine.
Yeah.
And also my intention was to expose them out to people outside of academics, because that was the other thing that in that residency training program specifically, is the only people we ever spent time with or were trained by or mentored by, whether they were physicians or psychologists or therapists, were all working in academic settings. So we weren't exposed to people doing really creative businesses or projects or in private practice or who'd left medicine or who are doing really, probably creative, helpful, healing things, even within medicine, even within psychiatry, that we never got exposed to.
Yeah.
So, knowing you, knowing other people in the community, having a life before I went to medicine at a later age, I kind of just knew I was connected to people that I could kind of intuitively bring someone to the table for this lunch that in a way did end up kind of being a salon. And then at the end of the year, I presented the project. It was a storytelling project. I kept a book the whole year with people's stories, with the conversations that I had with people when I invited them into the lunches, which were really confusing, especially for the physicians. We're like, I don't understand what it is you're doing or what I'm supposed to say. And all we did was just talk like human people,
Right.
which we hadn't done a lot of in the previous years, you know?
Yeah.
And it was really rewarding. So I saved the stories of the people that joined us or the conversations I had with people trying to talk them into joining us. And then I did my own creative project, which I'm just now remembering, which of course you remember because you're Kendra, over the course of the year to try and bring together, these different parts of myself, the creative person, the writer, the physician, the scientists, and I put them all together in a piece of art. So I did the same thing I'd asked my colleagues to do and presented it. Did I leave any parts out of the project? You can cut this whole entire story out if you want, because I know it's really long.
No, I think it's so unique and lovely, and like you said, something that's this very academic that you've been, just 100% of your life and time has gone into that academic piece for all those years. To have this other piece that's like, you are another person, you are a creative person, you have these other things too, and how can that tie in?
Yeah.
And if I'm remembering correctly, you had one person that was photography?
Yeah.
And who were the others? What were the others?
In terms of the art they did?
Yeah.
Oh, yes. Yeah. So I had several of the residents that did some photography projects. Painting, at a painter. Some people just shared their story, written or spoken. I'm trying to remember what else. I don't think I had any music. Although I had a musician, but I don't think he did a piece of music.
I'm trying to remember because you presented those.
I did do some of them, yeah. I
Yeah.
did show some of them. What surprised me was the people that came to have lunch with us. You know, I had several psychiatrists. I had a PharmD, like a pharmacist, who done a lot of work in addiction because I had a kid that was really interested in addiction subspecialty. He ended up subspecializing in addiction, but he didn't have a mentor or colleague, you know, that was in that specialty. So I invited him. He was a pharmacist that had done a lot of work for a substance use disorder. Another kid, a musician, who I think ended up doing a photography project, actually. I brought in a psychiatrist who had done screenwriting and was writing. And we had lunch with him. And that psychiatrist that was a screenwriter did consult liaison as a subspecialty of psychiatry. And that colleague of mine never thought about doing consult liaison. So he's like, because you did that for me, I thought of it opened the world up to me of other things I could do in psychiatry that fit me better. So it was fun to see, you know, who my peers were, because they were just a year younger than me. They were really my peers, although in some ways I was supposed to be a leader to them, who they were outside of work and see them kind of explore parts of themselves they hadn't necessarily been given permission to explore, and then to share it as much as they were comfortable with, but then to also meet people that maybe were supportive of their strange or unique or quiet ideas. And I'll say that the more surprising thing to me was the people that I brought into the lunches were so charmed by participating. So I repeatedly had people like, even the ones that didn't understand by the end were like, thank you so much. Like, these are parts of my life that I don't always get to talk about or share, or they didn't necessarily stop to have lunch off campus, you know, which was also a big deal about what I did.
Yeah.
Because you just never left the hospital. So for them to get to meet with us youngins was really just as impactful on the people I invited to come share a part of themselves with us. So it was it was my storytelling project. And then doing the presentation ended up being a creative process, and I invited everyone. So, you know, there's usually just like 5 or 6 of us residents that would come to these presentations, but I like handmade invitations and invited everybody that I felt like had impacted me in some way along my path as a physician or a human person. So there was standing room only. There was like, maybe 50 or 60 people in there. People were standing in the back. And so it was a real gift to me in terms of transitioning out of the from training into, you know, spreading my baby wings. Like, it was really meaningful to me personally beyond just getting that diploma or whatever, that more academic. I felt a lot of love.
Yeah.
So it ended up being real special for me.
Yeah, it was very cool. And it was also, you know, that Kelli thing of you know, adding your art and your creativity and your spark to it. And, you know, it was so unique compared to the other ones that we listened to. The other ones, like, just okay.
Yeah, they're more technical, right?
They were very technical, yeah. And you know, and that was good, I guess.
Yeah.
I've never been to one like one of those before,
that's how That's how I more thought of it. And I did. So I love talking about it and thinking about it now and hearing your perspective on it, because especially for me in that time, I think it was a really brave thing for me to do, because I did want to be a good student. I did want to be accepted academically. And I did go out on a limb a little bit. Yeah. And, you know, I got my ass bit about it a little too. But But you're right. I was me.
Yeah.
Yeah.
Yeah. It was
Like,
definitely you.
I feel right-brained and left-brained, and I wanted to bring more of myself to my job and my day-to-day. And I think, like, now that I've talked about it a little bit with some distance right now, like,
Yeah.
I think that's what I wanted the kids, I call them kids,
The kids.
the residents, the trainees, to feel permission to do too, because I felt like that would help them if they could reconnect with those parts of them, that would help them as a psychiatrist, that would help them enter this place where they had to be quiet in a room with a patient who might be crying or not saying anything, and they'd have to be okay. And I thought if they could be comfortable bringing their humanity to the room, whatever that meant to them, and not just their intellect or their knowledge, that would help them.
Yeah.
And so, yeah, okay, I guess I succeeded. Thanks, Kendra.
You did. That's why we really called you here today.
Like an intervention therapy
Exactly.
session.
We needed you to understand something about yourself.
That you are an artist.
All right.
So-
Okay, I'm an artist.
All right.
Okay.
So this is the time when we ask you to give us a prompt for our listeners who are also artists. And they're
Yes.
going to take this prompt and create, even if it is just a daydream. I want to put that out there too, because I think a lot of art happens in your head. And sometimes you actually put it out in the world. And sometimes you just think up something in your head and it's some great dance or play or whatever. And that's part of it too.
That's enough.
Yeah,
It's
exactly.
not just a daydream. It's a daydream.
It is. Yeah, that's true. It's a
Yeah.
daydream. And that is a creative process there too. So whatever it is that they want to take and create.
A cupcake, a daydream.
Yep. Any of those.
Yes. Oh, I have to say a word now.
Yes.
Yeah.
Or a phrase. Or
I think I am going to offer this word, brave.
brave.
Nice.
I love that.
Hashtag.
That's all I have to say about that.
Hashtag brave. That's good.
Thank you, Kelli, so much for coming up and sharing your story with us. Thank you for listening. Please go take #brave and create something with it, and make sure you tag us at Prompt Me Podcast.